Okay, our next speaker is our own Dr. Špela Miroševič, and she's talking about the value of mindfulness in practice for rare parents.
Hi, it's me again, but this time in a bit different role. So besides running the foundation, I'm actually a biopsychologist. I'm working at the Department of Family Medicine, where I'm researching unmet needs of breast cancer survivors and what kind of psychosocial interventions we can do with them to help improve their quality of life. It's something I'm very passionate about. And for several years, I have been running mindfulness courses for breast cancer survivors. And I've also implemented mindfulness in my life. I've know a lot of different psychological approaches to increase my resources. And one of them is mindfulness, which I found really, really helpful to me. And so today I would like to share you some research, basic research, but mainly what mindfulness is and how maybe you can try to implement in your life as well. So all of our here, the parents, we have lots of different challenges. We deal with intensive daily monitoring of our children. We have constant concerns about our child's health and well-being. And we also need to grieve the loss of the milestones not being achieved, but also the hopes and dreams we have for our children. And we can also experience social isolation because our experience is so different than our friends or our families. I have found myself a lot of the times in this fight or flight mode. For example, I have noticed in myself that during the day, it's always something. For example, my son is very sensitive to certain sounds, especially to if something is not working well. For example, sound books, or we need to be constant careful that these things, or that we have battery on reserve. And a lot of the times it's out of the sudden, he starts screaming and crying and I never know what is happening. And I notice in myself that I'm like, what is happening? And I'm like this a lot of the times during the day, and almost every day it is like that. And so chronic stress can lead to anxiety, depression, and a lot of different health conditions such as experiencing back pain, neck pain, tension, headaches, but also other problems like cardiovascular problems. We can experience sleep disorders, but also we can get more easily sick because we have a weakened immune system. And so what I have learned is that understanding and learning about what is happening in my body is actually helping me to manage the stress. Why? Because I can recognize when I'm distressed and I can either call my mom or my dad or my husband's mom. I need now support because it is too much for me, or I can better manage the time. And I can also use some self-regulation methods like mindfulness to get again in a state of some kind of normalcy. So usually when a stimulus happens, so a stressful situation happens, like when I'm home and my son starts screaming out of a sudden, in a normal day, nothing happens, he just starts screaming. If I'm not paying attention, I have this automatic reaction, which is I scream or I do something unconsciously. I get angry, I get sad, I'm absent, maybe I go on the phone. And so I also want this presentation to be a bit practical. So I would like to first explain what is happening with my situation. So in mindfulness, we are trying to divide the thoughts and the emotions and the physical experiences and also the behavioral. And it's important that within ourselves, we try to distinguish these four domains. And I'll go back to my situation with Urban, for example. When he starts out of a sudden screaming, my first thought is, what is happening? Is he hurt? What is going on? And then I feel scared. I feel anxious because I don't know what is happening. On a behavioral and on a body sensation, I feel my heart is bumping. And on a behavioral level, I try to go to him, but also if I'm acting unconsciously, maybe I yell to him, which then I feel guilty, of course, about it. And now I'd just like to take a minute for the parents mainly, to recall a situation that has happened not long ago, maybe with your child. And I'll just give you like 5-10 seconds to try to recall a situation that happened. And so now you can ask yourself, what is normal in that situation, the first thought that come to your mind? And then you can also ask yourself, what happens on a physical level? Like, how do you feel that situation in your body? Like, do you feel like weird feeling here in the chest or in your stomach? Anything you can recall? And also, what is this emotion that is driving this situation? Do you get afraid or do you feel angry? And then what do you usually do in that specific situation? How do you manage that situation? And so when we are talking about coping with stress, we are talking about the process of managing the gap between the real situation that is happening, but also our resources. And so usually in our case, the situation, the stressful situation is super, super stressful, not for normal parents. And so our resources to match that need to be, again, really, really high. Otherwise, we feel stress and it can get really bad. And so when we are talking about resources, there are two kinds of resources, so internal and external. For example, external resource, for example, is social support. This can be family, friends, or you can also get additional support. When you're talking about internal resource, this is like psychological resilience. How well do you manage to get up after something bad happens? The internal locus of control, for example, that you have a feeling that you can manage when something bad happens, as opposed that like something is happening outside of my control. That you have a problem-based coping mechanism, and that you have increased capacity for mindfulness, so that you're trying to be present in the moment as much as possible. And now, how to put mindfulness in this stress response? So if you have a stressful situation, a stimulus, and there an automatic reaction between those two situations, there is a space, there is a room for choice. And with mindfulness, you can train yourself to increase that space. And when you increase that space for choice, you can learn to calm down your emotions, you can learn to reflect, and you can act more consciously. It's like, it's not something that you do all the time, but it's something I think it's good to strive for or to have in your mind. But what is mindfulness? I really like the quote from Jean Kabat-Zinn. He was one of the first authors or the first people working with it. He said that you can't stop the waves, but you can learn to surf. So we definitely cannot change, at least to that degree, to go back and have normal children. but we can learn to adapt to situation and increase our resources. And so mindfulness is a form of awareness, a form of alertness, of paying attention. If you realize right now in the moment, you know that you can have your attention, you have it, you're listening to me, but you can also pay attention, for example, to your breathing. You can realize that your breath is coming to your nose and is going to your stomach. You know that your attention is with yourself, but you can also lose it so quickly because of the thoughts, or somebody is bothering you. Maybe you've noticed that when you were reading a book, that you came to the end of the book and you didn't know what you were reading, or maybe you were driving a car and you just lost your attention. So we cannot have attention all the time, but if possible, we can increase the chances by paying attention regularly and practicing. Jean Kabat-Zinn also put a very good definition to mindfulness, which is, this is the awareness that arises from paying attention on purpose in the present moment, which is the only moment we have, and we do that non-judgmentally. This is really important, that we don't judge our emotions, because we don't have effect on our emotions. We cannot feel bad because we feel angry or sad. It's just how we feel. And we also cannot feel bad of what comes to our minds. We can, of course, are aware of the thoughts, but we can also let them go. And this is basically what mindfulness is about. And I really like that approach, because it allows me to be who I am. It allows me to feel how I feel. And I don't like using my energy to pretend I'm good if I'm not good. I really like it. I've looked some of the research behind specifically benefits in rare disease parents. There are not many. Hopefully in the future, the field will try to move more on this. But mainly the studies were done in parents taking care of children with chronic conditions, but also for some of the ADHD. So the benefits in rare disease parents were to stress that mindfulness improves cortisol levels, so leading to reduced stress, but also it improves emotional regulation, so managing difficult emotions like anxiety and sadness. It also improves better focus and attention, so to helps you to stay present. And on a long term, it can also help you increase resilience. So how can we all learn mindfulness? This is actually an ability that is in all of us. We can improve it, we can work on it. It is a slowly process. Some of the research have also found that it can actually affect our brain. You can train mindfulness with formal and informal training, which I will present later. You can do formal training in mindfulness courses, and you can use mindfulness in everyday life. So here on the left, you can see mindfulness using mindfulness in the classes, in the formal classes. So this on a chair is sitting meditation, which we do in our mindfulness classes, but you can also do mindful walking and a body scan. The basic of this training is that you are just constantly putting your attention back on your body or on your thoughts. So you're kind of training to increase that space. But you can also use mindfulness exercises in your everyday life. For example, when you're washing the dishes, you can wash the dishes and think what I'm going to do tomorrow, or about the argument you have, or you can use this to practice mindfulness. So really washing and paying attention to every single thing you wash. It's also a training. You can also use mindfulness for eating, maybe just an apple. You will see the difference because you will enjoy every single bite you make. It's also mindfulness training that will help you increase that space. Or even better, you can try communicating with people, really listening to them. That will also significantly improve the relationship and communication. Of course, it's normal that the thoughts can go away when you're communicating with a person, but it's important to pay attention. There are several mindfulness interventions that are available right now. The most common one is mindfulness-based stress reduction that's used for general population, but also for chronic diseases, for depression, to prevent the relapse of depression. They're using mindfulness-based cognitive therapy. And then mindfulness-based cancer recovery is mainly for cancer survivors. And one of our authors from Slovenia also made mindfulness-based transaction analysis, which is for using in psychotherapy. And now my last slide, second last. This is an exercise that is really quick because I know we don't have time to do more work. So this is a very short exercise. I would recommend anyone to do it because you don't need much time. You don't need much training. It will take you just 3 minutes. So anywhere you are, you can be at home, at work, you can be walking. You use those 3 steps to get in a mindful place. In the first step, you're just recognizing what is happening at the moment. So if possible, you're closing your eyes and then you ask yourself, what am I experiencing this moment? So you can ask what am I feeling in a body. You can ask what my thoughts are. You can ask in a physical, emotional, and thoughts, and also what would I normally do? And then you leave that away and you just gather awareness and put awareness on breathing for a minute. So you observe breath coming into your mouth, through your mouth or nose, and you observe it to go through your body, and then you observe to go out. And then in the next step, you leave that as well, and you expand awareness again to your whole body, to your posture, and to your facial expression. You can try that and you'll see if it helps you. I found that very useful also on my programs. And the last slide, some of the recommendations how to embrace mindfulness in daily life. I wrote 3 authors I really like. So Jean Kabat-Zinn, Eckhart Tolle, and also the last one, Mindfulness in Plain Language, which can be maybe useful for somebody who is not so familiar with this. And then the practical tips. You can cultivate self-awareness if you check yourself regularly. Just a quick check, how am I feeling today? And you can embrace your emotions without any judgments. That will help you to improve your connections. And so to incorporate mindfulness techniques in your daily routine may improve your quality of life and well-being. Thank you very much for your attention.